Hello. Thank you for visiting Children's Emergency at KK Women's and Children's Hospital. Your child has been diagnosed with gastroenteritis. We have put together this video to help you understand more about this condition and how to look after your child. So what is gastroenteritis? Gastroenteritis is an infection of the gut or intestine. It can be caused by many different germs, most commonly viruses such as norovirus and rotavirus. The illness generally lasts for 2 to 5 days. Occasionally, diarrhea may persist for 10 to 14 days. Children with gastroenteritis are infectious. It is important to wash your hands thoroughly after contact with your child, particularly before feeding and after nappy changes. You should also try to keep your child away from other children as much as possible until the diarrhea has stopped. Some symptoms your child might experience include diarrhea or loose watery stool, vomiting, particularly in the first 24 to 48 hours of the illness, stomach pain or cramps, which is relieved for a little while each time some stool is passed. They may also have fever, be feeling unwell, and also not want to eat or drink. It is important that you monitor your child for signs of dehydration. These include lethargy or drowsiness, dry tongue, eyes or lips, not passing urine for the last 6 hours or more, or in infants less than 5 wet diapers a day, having a loss of weight, or crying without tears. If you notice any of these symptoms, you should bring your child to see a doctor for a repeat consultation. The majority of children with gastroenteritis recover well and uneventfully at home. There are 3 key aspects of your child's care: ensuring that your child remains well hydrated, managing their fever, and caring for the diaper area. The main treatment in gastroenteritis is to ensure that your child remains well hydrated with an adequate intake of oral fluids to replace fluids lost due to the vomiting and diarrhea. Types of fluids you can give your child include breast milk or formula milk, barley water and rice water, oral rehydration solutions such as Hydrolyte and Pedialyte. These oral rehydration solutions are the best option if your child is dehydrated, as they can help replace fluids and body salts that have been lost through the vomiting and diarrhea. Your doctor will advise the appropriate amount of fluid required daily based on your child's weight. Strategies to keep your child well hydrated are offering small, more frequent feeds. For instance, give your child 30 ml of fluid every 15 minutes instead of a large 100 ml cup in one sitting. This avoids loading the tummy, which can result in further vomiting. Offer your child fluids after significant episodes of diarrhea. Place sachets of rehydration solution in the freezer and turn them into ice lollies. Don't worry if your child is refusing food. Ensuring adequate hydration with frequent small volumes of fluid is key. Fever or a body temperature more than 38 degrees is a reassuring sign that the body is fighting the infection. However, it can also make your child feel uncomfortable. Fever medications such as paracetamol can be used to bring the temperature down and keep your child more comfortable. Another fever medication, ibuprofen, is generally not recommended in the setting of gastroenteritis. Regular ibuprofen can sometimes worsen tummy pain, especially if your child is not eating well. If your child is using diapers, frequent diarrhea may cause the skin in the diaper area to become irritated and even break down, causing your child significant discomfort. You may want to change diapers promptly after each episode of diarrhea. You can clean the diaper area gently and fully with soap and water and pat the area dry with a clean towel. Use zinc-based diaper creams after each diaper change to protect your child's skin. Remember to wash hands and diapering surfaces well after each diaper change to prevent further spread of the infection. You should seek medical attention if you notice the following. If your child has any signs of dehydration, such as dry tongue, eyes, or lips. If your child appears pale and lethargic. if your child has blood in their vomitus or diarrhea, if your child has frequent vomiting and as such is unable to keep any fluid down, if your child has greenish vomitus, a potential sign of gut obstruction, if your child complains of persistent or worsening abdominal pain, if your child develops painful swelling or fullness of the abdomen, or if your child's fever persists for more than 5 days. Key points to remember are: gastroenteritis is an infection of the gut or intestine, often caused by viruses. The main treatment is to ensure that your child remains well hydrated by giving them small amounts of fluid frequently. It generally lasts 2 to 5 days, but diarrhea may persist for 10 to 14 days. It is contagious. Wash your hands regularly and try to keep your child away from school until their diarrhea has resolved. Bring your child to a doctor if you notice that your child has developed any of the warning signs we explained earlier. We hope this video has helped you feel more confident in looking after your child at home. Do also refer to the pamphlet given for further details.